Hi, everyone. This is Talk Back. It is July 14th, 2020. We've been having an unbelievable summer in so many ways, so many issues coming up that we have to deal with, from the pandemic to the issues of racial justice, police brutality in our country. And I've been having interesting conversations with people in this country who have a lot to say about what we're doing, how to do it better, and the history of what's happening. I'm so happy today to have with me someone who is a physician, but is interested in so many other issues as well and can help us explain them. She is Dr. Lisa Tito. She is the director of the Santa Rosa Memorial Breast Center in Santa Rosa, California. Hi, Lisa. Good to see you.
Good to see you too. Thanks for having me on.
Yeah, it's great. People should know that we're really just like across the street from one another, because you're at your summer place in Mattapoisett, where you're staying for a few weeks, respite from California, and we're here in Mattapoisett right across the street. It's fun to do that. That's the beauty of all of the electronic media and the Zoom culture that we're living in. So, Lisa, I talked to you on the beach and get all of your wisdom, but I want to get other people to hear what you have to say. So first of all, give us a little background about your history, your education, why you became a doctor, and why you had an interest in breast cancer and breast surgery. Tell us about that.
Oh, it depends on where I start. I guess I'll start basically in Africa, because that sort of formed how I moved forward my training. So essentially I graduated from Bates College, great college, and applied to medical school and did not get in, which was probably the best thing that ever happened to me, because I went to Africa and worked in a Zulu hospital for 6 months. And it was there that I decided to become a surgeon. And so I did go into surgery. And after I completed my surgical training, my chief of the department told me, don't get stuck just doing breast because you're a woman. So I was like, all right, I won't. Until I started practicing and recognized I absolutely love the academics of breast cancer surgery. The patient population was spectacular, and I had an unbelievable passion for that field. So despite what he said, I immediately started working as a breast surgeon, and I've only been doing that now for about 20 years. That's all I do. And I developed a couple programs, like one in Taunton, Massachusetts, and then I ran the program at Plymouth, Mass, before heading out to California for a little bit better weather, and that's where I am now.
So for years, you were living in Massachusetts, and you were associated with the hospitals, medical centers in Boston and in Plymouth. What's the difference? Now you're in Santa Rosa. How is the culture of medicine? Is it any different than what it was when you were here in Massachusetts?
The medicine itself is pretty similar. I mean, because my field is pretty, we're all a very close field across the entire country. Like, we all know each other. I can call people up at MD Anderson or back at Boston or MGH, and we're all doing the same sort of things because we all read the same literature. But there's definitely a difference in the culture. You hear the stereotype of Californians who are kind of laid back and more chill. It's true. So that's been a little bit strange getting used to, because I'm like a little bit more regimented. I'm like, I want a day of surgery. I want this more regimented. They're like, why? It's all right. Just let it happen. So I've had to take down my more Boston attitude a little bit and learn to, relax a little bit more. So, but I'm adjusting quite well.
And then just as a sideline, when you first arrived in Santa Rosa a couple of years ago, you became embroiled, and I think that's a good word for it, in the wildfires that afflicted the area there. Tell us just a little bit about that. We saw you in the San Francisco Chronicle with your husband directing traffic when there were no lights in town, right?
Yeah, that was an unexpected warm welcome to the area, for sure. Because out here, I mean, like, it's raining, it's thunderstorming outside right now. We don't get that much rain in the summer, like for 6 months, not a drop of rain. and we'd never heard of fire season. And we happened to hit, and they're like, oh, it's always out in the mountains and stuff. You don't have to really worry about fire. It never gets into the city. Well, we moved there mid-August, and we had the worst and most devastating wildfire in the area 2 months later. And we were right smack dab in the middle of it. We were literally running from a giant wall of fire that was ripping across the road. Our area lost 1,500 houses burned, and they're still not all rebuilt where we are. But luckily, our house survived. But it was chaos for a couple weeks. You just had a ring of fire around the whole city, and we were just buckled down at the hospital doing the best that we could. And it was crazy. It was absolutely crazy.
And I heard, maybe through you or others, that the fire kind of just imperceptibly or without any rationality just kind of skips over some houses and hits others. And your house was saved, right? Pretty much.
Yeah, our house, everything above us except for one house is all gone. And then whole neighborhoods, like the streets across us, not a single solitary house standing. It all just ash rubble. It was like the fire bombings of Dresden is what it was. It was just.
And what about loss of life? Did any of your neighbors have serious burns, or some died? What about that?
We lost probably about, I think it wasn't that high, luckily, because one thing, they couldn't fight the fire, so they evacuated as many people ahead of the fire as they could, like on an urgent basis. So I think only about 15 people died. We didn't know any of them, but they were able to get most out, but it was devastating. 5,000 houses, over
Wow.
5,000 houses burned. And so try rebuilding 5,000 houses.
Yeah.
So it's taking a long time. But you did what you could. Like, again, my skills as a breast cancer surgeon weren't needed. So exactly, I went out and we directed traffic. And I did that for a few days. And then I worked with the shelters trying to coordinate. We had a lot of stuff being donated. A lot of nurses and doctors wanting help because all the other hospitals were shut down. And our hospital was the only one working because the fire was happening at the other hospitals.
Now, a few weeks ago, I read that the wildfires could come back to California. Can you imagine, with the pandemic and the hospitals and that? Is there any news on that score? Have the fires stayed away so far?
No, I get alerts every day on our phone, and we've been having actually a fair amount of brush fires already. I'm seeing a lot of them, but they're small. The big difference with the big fires, like one was last year too, that was lapping at our door too, is wind. So when there's a high wind, like 40, 50 miles per hour, it just drives that fire. And that's what happened with the Tubbs fire and the Camp Fire and these other fires. So as long as it's not super windy, the fire department can take care of it. But you did bring up a good point, and we are thinking about that because we could have another huge fire. And what do you do with those people? Imagine having a shelter situation, because we lost 5,000 houses. Where do you put all those people? And then you throw that in during the pandemic where you have to have social distancing. It's almost inconceivable, to be honest with you. It's going to be a disaster, absolute disaster. So we're hoping, fingers crossed, but we'll see. But yeah, we're worried about that.
Okay. Well, I do want to get to your expertise in breast cancer and research. And I know you're an expert in diet and the kinds of ways that we need to keep ourselves healthy to avoid the breast cancer if we can. But I do want to talk to you as a doctor about what's happening in the pandemic. So I guess I'm interested to know, as a physician, when this thing was getting started, do the doctors in America get alerts, get information? What advance notice or word or worries did you have as this thing was getting going in January, February, March? What was the medical community saying to one another at that point in time?
To be honest, at the very beginning, I think we were like everyone else, like, this isn't going to be happening. It's going to be just like SARS. We're going to be fine. It's the flu, like everyone said, 17,000 people died this year from the flu in America. We're like, that's a lot. And you hear about these little specklings of stuff over in China, and we're like, it's never going to happen. And that's how, to be honest, a lot of us were until Italy hit. And once Italy hit, all of us just said, wow, wait, this is real. And that's when we started all recognizing, what do you have to do? And I think each community handled that very differently. I think California did a really good job. Our government, luckily, was on top of it. And we were the first area, San Francisco and Northern California, where we live. We shut down immediately. And that's why we were only seeing 2, 3, 4 cases a day. And we only had 4 deaths in our area, our whole county, until 2 weeks ago.
Yeah.
But what we get a lot of our information the same way you guys do, to be honest with you, because it's such a constant change. It's so rapidly changing that you have to see where are you in your hospital and what do you have to know right now.
Right. So this is the big issue as a citizen, as someone who consumes a lot of news. I guess I'm a news junkie. And I know a little bit about how the government's supposed to work. You mentioned California doing a good job. Other communities, I live in Connecticut in the winter. Connecticut did an excellent job, and we have very few people even in our hospitals, and certainly in Eastern Connecticut. But we have a federal system in this country where each state can make its own rules. Each governor can set out executive orders, shutdown orders, and so forth. But there has to be, and I want your comments on this, an overall national strategy. Yeah. Yes, each state can do their own thing, but there needs to be a national strategy, a plan for how each state will get information, each state will get equipment, the things that are needed for the testing. All of that seemed to kind of fall apart in terms of a national strategy. I want you to talk about that.
To sum it up, the national strategy was an absolute abject failure. It was abhorrent. The fact that we live in this amazing country with unbelievable resources and strengths and creativity and businesses, and we're united. And despite that, they did horribly. So we were in situations where, like you said, the testing, and that is key. We were fighting each other for the testing. If we had a decent government, what they could have done is instantly taken people and said, hey, your factory, we're going to start doing it, testing stuff. You're going to send it to this state. You're going to send it to this state. You're going to stop what you're doing and ramp it all up. And the same with PPE, because we didn't have enough. No one did. So everyone was just, scrambling to buy gloves before the other hospital buys gloves. And in America, that shouldn't happen. But if you had leadership up high, they could have formed an incredible response to this, and we wouldn't have seen as many deaths. And it wouldn't have put us at risk as physicians as much as it did in New York without the proper PPE. And that was purely a failure from the top. Because, yes, our governments work differently. So some states like us, we got supplies pretty well because Newsom was all over it. But that meant that it was taken from other states, which, had more trouble. So states did well if you had a good government, but the country could have done so much better. And I'll blame it 100% on Trump, because I'm sorry, that's where he says I'm the power, and he is the power. So it was his failure. It was horrible.
Well, it's not just the failure of incompetence and not doing the things that you said were necessary to do, to commandeer the equipment, the testing capacity, make a national plan for how each state would get it. Instead, each state was fighting with the other states can you imagine? They were fighting over equipment. It's unheard of. It's unbelievable. But the other big issue besides the incompetence is the misinformation, the outright lying about what's happening in this country, the outright lying about testing, saying that the reason we have so many cases in America is because we do the best testing in America. That's totally ridiculous. And it all sums up in the total mistrust that so many people, many of them Trump supporters, have of expertise, of science. Right. I mean, other countries don't have that. Many of the countries that had terrible things like Italy, at least they all follow the leadership in how to deal with it. I want you to talk about that. It's not just the incompetence in the medical issues. It's the misinformation, and it's our own government, Trump, turning against his own experts and his own national strategy.
Yeah. You're exactly right. And lots of people have died because of that. You're absolutely positively correct. As we learned, one of the problems was we were learning as we were going. So what they did was they used that little bit of, we're not quite sure this information is true, we're just trying our best to save you guys, as, well, hey, that didn't work out, so they're lying to you. You doctors, yet again, are telling us something different. And it's like, no, we're not. This is how it works. But they use that to sow dissent and distrust, because that's their modus operandum of how they do things. And so it worked brilliantly, but to what end? I don't even understand what they were trying to accomplish by getting them not to trust us doctors, because we can get control of this pandemic if you wear masks, and masks work. Because if everyone wears their mask out in public and washes their hand, you're not going to get COVID. Yet we have our president who's out there all the time without a mask, then having rallies and saying, yeah, you don't really have to wear your mask, and we're going to, put you guys all together and close to each other. So again, you look to leadership. What is leadership doing? What is their role? Their role models. And the role model half the country was seeing, because they believed in Trump, was don't wear a mask. You can get close to people and go out and do whatever you want to do it. And let's get that economy going. And that message killed people. I mean, thousands of people are dead because of that message. And to what end? That's what I rack my brain with, is what was their goal?
Oh, I know the goal. I can tell you the goal. It's a political goal. Trump does not do anything unless it will help his own cause, which is to be reelected. He needs the pandemic to go away, to be minimized, to blame it on someone else other than himself. So he cannot take the blame for it. So it's Dr. Fauci's fault now, which is an unbelievable, despicable, crying shame that he would do that to a respected scientist. It's everybody else's fault. It's the governors of the blue states. And that is the reason. He needs to minimize it. He needs to take the blame away from himself in order to get reelected. It's as simple as that. Everything leads toward his reelection. He needs the kids back to school. It doesn't matter that it might be dangerous for kids to go back to school. It doesn't matter that teachers may be in trouble if they go back to school. We must get the kids back to school, because then the parents can go back to work. The economy can start rolling again. So by November 3rd, when we have the election, he can say things are back to normal in the economy. Okay. I think that's it. I can't read people's minds, but that is definitely what I believe is the motivation. What do you think of that?
I think you might be right, because he's very clear. He doesn't care about anything other than him. When you have people like John Bolton, who's pretty conservative and out there, saying that he himself doesn't trust Trump, and Trump has no desire to do anything well for our country other than make himself better, get reelected, I think you might have hit it right on the nail. That's probably a good theory. But that, again, is appalling. That's not leadership. That is not a leader you want in charge.
But then, as a scientist yourself in the medical field, I want you to talk about the issue of people respecting science, respecting research, respecting the idea that you don't have to get everything right. You have a theory, you try something, you do the best you can. When new information comes along, you change and evolve your plan to suit that new information. And how do you feel about the federal government, the White House, discrediting a reputed, wonderful scientist who's been around for 40 years in this government, working in every administration? I mean, talk about that. We can't have that in this country. We have so many people who don't trust the scientists and are saying terrible things about Mr. Fauci. It's unbelievable.
Yeah, no, and I have to say, Fauci has done a remarkable job. He's in a really difficult situation. For him to be able to, because he tells the truth, and he knows he's the guy sitting behind him or next to him is telling lies right next to him. So he has he's somehow walking that tightrope of still giving us the truth, yet not quite getting fired yet, because Trump is saying completely the opposite thing. So I respect him completely. And this whole concept of people mistrusting science, it's real. And I kind of had that conversation with my breast cancer patients when I've seen them the first time. And kind of what I tell them, because science is not perfect, it's an evolution. We learn, and that ask more questions, and we try and answer that question, and we learn about another question, and we keep evolving our theories. And sometimes they get disproved, but often, things fit. So you can look on the internet, right? So essentially you can find anything you want to justify what you believe. It doesn't mean it's true, but you can find anything. So in the breast cancer field, you can find things like vitamin C will cure cancer, breast cancer. No, it won't. It'll just make you broke and you'll die, okay? But you can find it on the internet. So what I ask them to do is to trust me, because what I have is, like you alluded to, is 20 years of that framework of data and information. So if you have that framework anything new that comes in on the internet or a new study, you have to figure out where's it fit in that framework, because you have that framework. If you just take that information nakedly, it's meaningless almost. So our country, unfortunately, as now half of our country, I would say, has not developed that framework for anything. So when they get new information, they don't have that background. And I think that's a failure on our education system, a dumbing down of America. And without that framework to put that information into, you can get manipulated. You can get lied to. You can make really horrible decisions. And it's like, to be honest, they're like sheep being led to the slaughterhouse. Literally now, they're being led to the slaughterhouse because they believe here. Because Trump says, hey, you don't really have to wear a mask. I'm not. And it's just not true. And people are dying because of that. And that's a fallacy of our education system not teaching us the framework to put information into and critically analyze the information. And then it's really sad.
And it's amazing that we even have to say this, that we even have to tell people, trust science, trust your doctors, trust Dr. Fauci, trust the Centers for Disease Control and their guidelines, listen to them. It is just amazing that we live in an American culture now where things are just turned upside down. It's that you even have to emphasize the importance of what you just said is amazing. It shouldn't be necessary. I also wanted to ask you about the role of many Americans, still millions, not having health insurance and how that factors into the pandemic and the work in the hospitals during the pandemic. The American Medical Association support national health insurance, universal coverage?
I do. I think that's an amazing system, and it's the most efficient system. There's this, again, misconception, misknowledge in our country about how healthcare actually works, and how other countries actually work. And again, it goes to this mistrust. Everyone's like, well, if you have one, it's going to be a failure. Like, bureaucracy never works. It's going to be a mess. But guess who is the most effective manager of money in the healthcare system? Meaning, let me re-say that. So if you look at an insurance company, right, you want to say what percentage of the money that is brought in goes to healthcare costs as opposed to administrative costs. Okay, get that concept?
Right. Why do we need insurance companies? They're just like the middlemen. Why do we need them to begin with?
Well, right. So if you look at those private ones, right, you'd think they do a better job of administering the money, right? So you'd think they'd have a lower percentage, right? But Blue Cross Blue Shield, their overhead is like 10%. Medicare is like 3%, meaning they manage it better than the private companies. But no one really knows that. So this concept that the government can't do it is not true. And it's a much better system if everyone's covered, because then you get preventative care. So you don't get as sick as you can when you don't get that preventative care. You get your testing done. You're introduced into healthy lifestyles. And a lot of diseases can be changed and actually prevented if you do a lot of very easy things, but you only can do those things if you have access to healthcare. So I'm 100% behind one payer system. For sure. No question about it.
And most American seniors, even those who will rail against national health insurance, love their Medicare. And I don't know why people can't make the logical jump from your Medicare is good and you appreciate how that works to Medicare for everyone in the country. It doesn't make sense to but I think what happens is, again, we have this bugaboo, socialism. National health care is socialistic. It's communistic. And guess what? If you go to Canada, you have to wait 12 years to get an operation. That's what you hear. Or if you go to England, well, that's not necessarily true. And in France, in England, in Canada, in Israel, there are a lot better health outcomes that American people will not accept or admit to, right?
Yeah, I mean, that's the ironic thing is we actually spend more money on healthcare than any other country, and we have worse outcomes, as you alluded to. We have higher mortality rates for infants. I mean, that's appalling. We have more deaths during childbirth. It's just we should be at the top of all this, and we're not. So despite throwing all that money into it, it's not making us healthier. But again, a system where we really approach health as opposed to sickness, because that's the way our system is set up right now. Let's treat sickness, and you get rewarded for doing more tests and more, procedures and all that stuff, and that doesn't make us healthier, as opposed to rewarding prevention. Keep this person healthy, and you'll be rewarded more.
Right.
That's the way that a lot of other countries approach it, and they are better systems. We're failing in our healthcare system.
And then there's the other issue of many people don't realize that all the people who don't have health insurance make it more expensive for the rest of us, because without the prevention and the annual checkups, they get very sick and they go to the hospital, and we still have to pay for it, right?
Right.
So,
and it gets more expensive. And I just want to go back a little bit to your comment, is everyone's worried about socialism, right?
yeah.
So if medicine in the current system, this is pre-Obamacare, okay? Pre-Obamacare, the way the medical system worked with private insurance is I would do, say, a gallbladder surgery, right? So if it truly was capitalism, I would say this is how much it costs, and insurance would give me that much money. But it didn't work that way. It was basically socialism. I mean, I had no say at all what I made from insurance companies. I would say, hey, I want $1,000 to take out a gallbladder. They say, that's great. We're going to give you $300.
Right.
That's not capitalism. So we've never
Right.
had capitalism in the healthcare industry. It's just not there. It's just who's taking the money. And when the insurance companies take the money out of the system loses a lot of the research and health availability for buying equipment to keep you guys healthier. So they're taking that piece of the pie out completely and putting it in people's pockets for wealth. If it used how it used to be, if it was stayed in the system, it got used more efficiently and hospitals grew and got better. But there's a giant chunk that was taken out because of health insurance companies. So if we do go to single payer again, that money now is not going to people's pockets. It's coming back to healthcare, and everything gets better.
Yeah. Yeah. And people don't appreciate, we don't have pure capitalism in this country anyway. We have a kind of a mixture. And some people say we have socialism for the rich and capitalism for the poor, but that's another show. Before we get to your breast cancer expertise, we want to do, I just want to talk a little bit more about the pandemic, because now your state where you're living now, California, just closed down the state because there's an explosion of cases. Why do you think that's happening after California did such a fairly good job initially to keep things down?
Well, it's pretty easy. We reopened. Now, they tried to do it very slowly. Newsom was on every day saying, here's our plan. Here's what the benchmarks we're going to hit. And also with the plan, if we hit these benchmarks, we're going to shut back down. So what happened is people started going out. Not everybody followed the rules. And so you shouldn't be going to a bar. I'm sorry. You shouldn't be going inside with a lot of people and not wearing your mask, because that's how it spread. So a lot of people started doing things and not following the rules, and we're reaping those benefits with increasing numbers. Now, again, Southern California is a lot worse now than Northern California, where we're going back to. But yeah, we're going to have to shut down the economy. And again, if you don't do it right, it's more damaging to the economy as opposed to, say, like Texas, who just opened up completely with nothing in place. And we can see how horribly that's going. So even in the best state where we really did manage it well, this disease is real. The virus is not going away. So we did everything perfect, and we're still going to get killed unless everyone follows the rules, and everyone's not following the rules.
Yeah.
Some people don't know if they have it. Can I share like a story with one of my patients? Because this kind of exemplifies what we're seeing is, two stories. One of them was a young woman who came in, and her family's in Wisconsin, and they're Trumpers. She is not. And they're like, hey, this is not real. So they had a family reunion, and a whole bunch of people got together. One of the cousins was coughing. Nobody was wearing masks, COVID positive. So he's exposed his entire family, like 20 people, including grandparents and stuff. And he might be the one who brings it in, that disease, and kills those grandparents because not following the rules. And what we're starting to see otherwise too, is we're starting to see our kids start playing together, right? And so I had one patient who I just operated on her for breast cancer surgery. and I called her or Zoomed in for her post-op visit, because that's how we're doing it now. And she was worried because her son had been playing with this kid, who had been playing with this kid, who got tested as positive for COVID. So I had to tell her to isolate her son and wait for the other friend's test, which came back as positive for COVID. So now her son was directly exposed to COVID, and we're seeing that progression now. And so initial stage, what we're going to see, or we anticipate seeing, is we're going to see the young people getting it, right? They don't get that sick, and luckily, so they don't use up a lot of beds. But then 2 weeks later, you're going to see the older people get it from these younger people, because they don't always know they have it. So in another 2 weeks in California, I'm anticipating we're going to see a jump in hospitalizations, because now the older folks are going to get it. And then 2 weeks from then, we're going to see our mortality rate go way up.
Yeah. And I think, as you mentioned before, we seem to have failed spectacularly at making tests readily available and readily answerable. We talked about my granddaughter. It took her 7 days to get her test results in Boston, which had been doing a good job. But in 7 days, that almost makes it worthless. And then the contact tracing, which they say is so important to tamp things down, they're not doing that successfully at all. So let me ask you, things are bad in this country right now as we sit. As a physician, as an American citizen, depending on wherever you live in the country, what would you tell somebody like me? I happen to be in the more risky, older category, but what would you tell an American citizen how to behave the next few months in this country?
Right. It could be the next year. Okay. But yes, so this is the new normal. Do we want it to be the new normal? No, no one wants this. But this is what we have to do, because it does work. And we're going to learn more. But right now, what we know is social distancing is effective. So how do you socially distance? Well, stay at home. If you can't stay at home, then you make sure when you go out, you wear your mask. And if you see someone who's not wearing a mask, you stay away from them. And then if you touch things, soap and water works brilliantly, because it breaks down the little coating. It's a little virus inside of this coat. And the soap kind of breaks it apart, and as does the alcohol, makes it naked so it dies. So soap and water works, and hand sanitizer works. So if you go to the supermarket, bring some hand sanitizers with it. Wipe down your basket if it's not been wiped down already. Stay away from people. Second you get back into the car, more stuff. Wash your hands with hand sanitizer. And again, stay away from people. And I know it stinks, but that is what we have to do, and we know it works.
Can we be more casual outdoors? Is it true that the droplets from the coronavirus are more difficult to pass around outdoors, especially in a windy day? How does that work?
I mean, again, the current thinking on that, and that can change. And that doesn't mean we're lying to you guys. It just means that's a knowledge. We work on based on what we know right now. So what we do know right now, it seems to be how long you're exposed to how a big volume of virus. Okay. So how does that work indoors? It can be, more virus there. So if you're indoors with a lot of people not wearing masks for like an hour or two, that is your maximum chance of getting a coronavirus, like going to a restaurant. If you're outside on the beach and you do keep social distance between your groups, so you sit away from people, you walk away from people, you swim away from people, and that means, you have to be patient, and it's not the way you used to do it. But if you do that, very low risk of getting the virus, as far as we can tell so far, because it seems to disperse. And it's again, not just exposure to the virus, but concentration and time. And you don't have that outdoors, because you're outdoors and it's not concentrated.
Right. And you said, not very happy to hear, but I think we have to be realistic. It's going to be for a while, and a vaccine isn't coming at least until next year, right?
Yeah, well, there's some companies right now that are revved up to crank out the vaccine. They're not positive it's going to work, but they're they're gearing everything to crank out these vaccines. So people are hopeful, but boy, we'll see. That'd be great. That's what we need. Otherwise, like my parents, they're 80. They have not left their condo since early March. They've been hunkered down since then in Santa Monica, California, because it's not safe. They can't socially distance there because there's so many people. So even going out on the sidewalk, there's too many people around. And again, not everyone's wearing masks, and that can kill my parents. We have a friend of ours here who was killed because his son's girlfriend wasn't following the rules, came into his house, gave him coronavirus, and he's dead now because that girl killed him because she didn't follow the rules and brought it in and killed him. And that's just, you hear story after story of things like that. And that's what I have to say to the young generation out there is, yeah, you guys aren't going to get very sick. You're going to get sick, but you're not going to get very sick often. However, what you're going to do is kill your grandparents or your parents, and that's just, don't do it.
And because we don't have rapid, immediate result testing, it's impossible to know. And is this a comment also about sending the kids back to school?
Right.
Do you have any thoughts on that?
Yeah, that whole, that's just going to be tough. I mean, I think everyone's watching the other schools around the country to see what's working and what's not. But again, if you follow the rules, you come in, you wash your hands, you have hand sanitizer on your desk, you wear your mask the whole time, and you spread the classrooms out. So you're, again, socially separated, social distancing. And, probably half people have to be home, have to be there. They're going to have to restructure the day. Even then it's going to be, a risk. And then when you get home, you got to wash your hands and make sure you're not bringing it in. They shouldn't be bringing textbooks back and forth, but I think it's going to be hard, but we still have to go to school somehow, but they really have to work hard at making it safer because the kids are going to be fine, but they bring it home to their parents and their grandparents. Right.
And I worry about the many teachers who are, many of them seniors or older, that they have to be careful as well.
Yeah.
So we want to get to your breast cancer expertise because that's what you do. That's your passion and your work. Tell us, what is the incidence of breast cancer in this country, and has it gone down?
So if you look at our numbers, it's about 12% risk of getting breast cancer over your lifetime. And it's stayed about the same, but what has been coming down is our death rate. Less people are dying from breast cancer, and that's for a variety of different reasons. But one of the main reasons is screening mammograms. So getting your screening mammograms every year when you're younger, meaning like from 40 to 45 to 55, very important to go every year. If you're older and average risk, then it's probably okay to go every 2 years, but only half of our population is average risk for breast cancer. So unless you know that, you should still go every year. So that has changed a lot. The incidence is about the same, but I anticipate, to be honest, that it'll go up because it's basically a disease of aging. And as our population really is aging, we will see an increase in breast cancer rates.
And is there more treatment for just the lumpectomies and less full out mastectomies? What are the treatment changes that you're noticing?
Yeah, so I'm the surgeon, right? And so it's my job to take the breast cancer out. And as I tell my patients, we have choices of how I take the breast cancer out. And the good news is that breast cancer has no idea what technique I use to take it out and doesn't care at all how much normal breast tissue I leave behind. So it means you don't have to have your breast removed. So most of the time, I'd say our rate is about 85% of the time I do a lumpectomy, which means take out the breast cancer, leave the breast tissue, the normal breast tissue behind. And sometimes we're stuck doing mastectomies when the breast cancer is too big. And so I literally can't take it out. I can't use that technique. So sometimes I have to do it for that reason. And other times I have to do it for people with a genetic mutation, which is really, really rare.
Yeah, I was thinking about that because, people of Ashkenazi Jewish heritage have this BRCA. Maybe you can talk a little bit about that. Mm-hmm. And that sort of reminded me of the Angelina Jolie, where she determined she had this propensity toward it. And so she decided to have mastectomy on both breasts. Talk about that issue.
Yeah, absolutely. Because this is a big misconception in our country and around the world. Because a lot of people think it has to be tied to your family history. And part of the reason is because we keep asking you about your family history. But the bottom line for breast cancer, if you get breast cancer, 90% of the time, it is not related to a genetic mutation. 90% of the time. And if you just take a random person off the street who has not had breast cancer, the chance of having genetic mutation is less than 1%. Even in the Ashkenazi Jewish population, if there's no cancer in your family, you only have like a 3% chance you have a genetic mutation. But we want to find those families, and that's why we ask you about family history, because everything is different for them. Instead of having a 12% risk of getting breast cancer in your life, basically because you're getting older, and I can go through that if you want to at the end. But
Sure.
So that's, if you have a BRCA mutation like Angelina Jolie, she had a 60 to 80% chance of getting breast cancer over her lifetime. So that's completely different. And a 40% chance of getting ovarian cancer, while our population risk is about, under 2% risk of getting ovarian cancer. So if we find these people, what we do is we screen them differently. So we start screening people for breast cancer at age 25. And we do things to help reduce your risk of breast cancer. So that's one of the few times we recommend thinking about having mastectomies when you're younger, and definitely taking out their ovaries before they're 35 or 40, because we don't have a way to find ovarian cancer early. So we want to find that tiny needles in a haystack, because
Right.
we can prevent them from dying. But then that makes everyone else think it has to do with family history. And I've heard lots of women say, I don't need to be screened because I don't have any breast cancer in my family. So this is what I like people to hear. So these are the 3 risks you need to get breast cancer, because most likely you're not someone with a genetic mutation. Here's the 3 risks. Are you a woman? Do you have breasts? And are you getting older? It's disease of aging. And that's the only 3 risk factors you need to have a 12% chance of getting breast cancer over your lifetime. So everyone needs to get screened. Everyone.
And where does it, so that's very important to hear, but where is the education from the medical profession? I have a mammogram every year as part of my annual checkup, and I've been doing that for many, many, many years. But for the general public, how are we getting that message out that you need to check, you need to be screened, you need to, what is the education component of your organization, for example?
Right. I mean, there's local and there's national. So there's a lot of organizations nationally that try to get the information, like the Komen Foundation, American Cancer Society. They can do it at the national level just to keep, like, October is Pink, Breast Cancer Awareness Month. That's very powerful. But from a local level, what you have basically is advertising. You have people like me going out and giving talks. I give a talk anywhere, anytime, to any group of individuals. Like, you call me in 15 minutes, yeah, I'll be there. So I do that as much as possible as well. So we do that 2 to 4 times at least during the year. And I think, to be honest with you, I think the message that you need mammograms really is out there in our community. And the only thing holding back is that piece of the puzzle saying, I have no family history of breast cancer, I'm fine. So those are the things we try and hit from, like, an educational standpoint locally and also nationally. And then your primary care docs, that they know. And that's one thing I also do, is I have to educate the primary care physicians, which I do, when guidelines are changing about screening recommendations. And I gave a huge talk on it to all of our primary care physicians at a symposium when I first got to California, for the whole Northern California. So those are the things I can do locally.
All right. Now, what about, so there's screening and then there's treatment, cure. Is there such a thing as a cure?
Yeah, it's a strange concept. So basically, cure means we get rid of all of the cancer cells, okay? And this is a kind of a weird concept to wrap your mind around. So for breast cancer is a disease of the breast and your body from day one. Now, that doesn't mean the breast cancer cells in your body can hurt you, because that's what it's hard to explain to patients, this concept. But what it means is the breast cancer in the breast is bad, but it can't kill you. It just grows really, really big. And I've seen it completely replace people's breasts and bleed and all this horrible stuff, but that's not going to kill the person. The only way you die from breast cancer is those cancer cells learn to grow in another part of your body, which is really, really, really hard. So in order to cure a person of breast cancer, we have to get rid of it in the breast and wipe out or suppress all those little cancer cells in the rest of the body before it can do harm. So there's a couple types of breast cancer. One of them is ER positive, which just means they have a little mailbox on the cancer cells that you can deliver estrogen into it. And estrogen is like fuel and makes them happy. So the mainstay of treatment of that is just block that mailbox. Okay, and that's that pill tamoxifen or any of those relatives. But here's the kicker. We're not killing all those cancer cells. We're just kind of putting them in timeout. So for those women, we can never say you're cured because we haven't actively killed all those cancer cells and we can't. Now, most of the time, they're never going to harm you. And people, over 90% of people will live, but I can't say you're cured. But there's another type of breast cancer that has no tags and is very aggressive. And we know that if we give you chemotherapy and we give it before surgery, if we give chemotherapy and then I do surgery and all the cancer cells are killed in the breast, that's a surrogate for all the cancer cells are cured in your body. And that group of women, we actually can tell them they're cured. So it's a weird concept, like what does cured mean? So ER positive tumor, you're probably not going to die from it, but their cancer cells are still there. ER negative tumors, if we win, we win. But if we lose quickly. And we know within 2 years which group you're going to be in.
All right, but are there any prevention strategies, since we don't have a cure, we don't have a pill, we don't have a vaccine you can take to prevent those cells becoming cancerous in your breast? Is there anything prevention-wise?
Yeah, so we can't completely account for any mistake. So cancer is basically like you have a cell that's normal and it divides and makes a mistake. And that, there could be something that caused it to make that mistake, right? And that's kind of how you get cancer cells, right? So you can't prevent all mistakes and fix all mistakes. So sometimes it gets through no matter how perfect you live your life. But in general, there are strategies to lower your risk. And it's all about modifying risk. You can't be 100% protected or 100% you're going to get it, but you can modify risk. So number 1 through 20 for every disease out there is don't smoke. That's an obvious one. Don't smoke, don't smoke, don't smoke, don't smoke. All right. Number 2 is lead a healthy lifestyle. It actually matters. And what that means is be very active. Go out there, do stuff. If you have a choice between sitting on the couch and doing something active, always choose doing something active. Because the more active a woman is, even in their teenage years, the lower risk of getting breast cancer when they're older. The other thing is alcohol. We're preaching now moderation. What is the definition of moderation? You kind of know it when you see it because there's no set thing and that keeps changing a little bit, but moderation. But the biggest thing is estrogen exposure. And so that means after your ovaries shut down and stop producing estrogen, there is still estrogen in your body. And so there's ways that you can reduce that estrogen in your body. First of all, by not taking extra estrogen. So hormone replacement therapy, there is a higher risk of breast cancer with that because you're extending your exposure to estrogen. But probably the most important one is obesity. So if people are overweight, they have a much higher risk of developing breast cancer after menopause because those little fat cells store estrogen and some other stuff that's bad too. But the more fat cells you have, the more estrogen you have, and the higher your risk of breast cancer. So eating healthily, maintaining that normal BMI, your body mass index, say like this is your range of normal weight for your height. That is the most important thing women can do for breast cancer and a whole bunch of other diseases. But I know it's hard.
Yeah. Now I know that you've worked on a book, I don't know if you're in the publishing phase yet, where you have developed a diet and eating and food strategies, I guess for pre-breast cancer, just people to have precautions beforehand, and also for your patients. I want you to talk about that.
Yeah, so it's probably the most uncomfortable conversation a doctor will ever have with a patient is to say, hey, you need to lose weight, because no one takes that well. And they look at us and say, I hate that doctor. But we have to. And so it's so incredibly hard to do because people don't respond well to it. And also it fails miserably all the time. So we basically say, hey, you know, cut down on food a little bit, you know, don't eat this one thing and eat veggies. Well, it doesn't work. As anyone who's ever tried to diet knows, it just doesn't work. It's so hard to do. So I've been working with my patients for over 25 years now because I have to get them to lose weight because we know the risk of cancer coming back is higher if they stay obese. And even if I get them dropped by like 10%, they have a higher chance they're going to live from their cancer. So it's important. So I finally developed a strategy after failing miserably for 20 years, getting my patients to lose weight. Because when I finally had, it was literally like a light bulb went off in my head. I was sitting one day in my office going, how the heck do I get all my patients to quit smoking, which is also really hard to do. But I'm an ace at that. And I got that nailed because I understand the addiction. And I understand how the addiction is working in their brains and how to kind of unearth those lies that they're being told to support that addiction. And it's very effective. And that's when it hit, when I realized what we're not doing is addressing the addiction of our processed food industry. And once I figured that out, everything changed. Because once you know there's an addiction, and then you figure out how do I counter that addiction, the whole goal is to get your brain working the way it was designed by evolution, thousands and thousands of years, to keep you at a healthy weight, irregardless of your activity level. It knows how to do it. We just have to let it. That's how we have evolved. But the problem is when you're on those food in America, which everyone eats, probably 70% of most people's diets is processed food and they don't even recognize it. And it basically turns off the satiety center in your brain. And that's the part of your brain that says, hey, stop eating. You're full. Mine works. I don't count calories. I just stop eating when I'm full. But if you're on processed food, it doesn't work. So you can't stop eating. It's not your fault. You can be the strongest, most motivated person in the world, but you cannot overcome chemistry in your brain. You can't. It's impossible. So you are driven to overeat. You're always hungry. You're constantly thinking about food, and your portions are probably 2 to 3 times more than you're supposed to eat because of this addiction. So get rid of the addiction. Get your brain working for you instead of against you, and then it's all easy. Now, you still have to eat properly once you're working, that. You still have to follow the normal rules of nutrition, but you can now. And your body is helping you do it now. And once people do this, it transformed everything for my patients.
All right. So how do you get rid of the addiction? What are the keys to getting rid of the addiction?
So here's the key in a nutshell. Okay. The whole philosophy is for 1 month. It takes about 1 month to reset this. Okay. And it's really 3 weeks, but we doctors, we always kind of wiggle it a little bit. We say, hey, don't wash that cut for 2 days because we know you're going to cheat and wash it, or for 5 days because we know you're not going to listen to us. So we want you to get past day 2. And that's why we tell you day 5, right? Because you're going to cheat. So it takes 3 weeks, but I tell you 4 weeks. You can eat anything you want for 4 weeks, as long as it's real food. And I define real food as food is alive, right? And we harvest it, we shake it off of the tree, we pluck it, we kill it and cut it up. We plop it from a chicken, an egg. That's real food. And only real food for an entire month. So you can eat anything you want. I don't care what it is, as long as there's not 1 drop of the drug hit. And that drug hit is anything that wasn't from scratch. And if you do that, it works. And then after that, your brain is working again, and your brain says, stop eating, you're full. And after that, I then teach my patients how to reintroduce minimally processed food and how to let factories help you with a little bit of to save you some time. But you're never going to go back to eating all the stuff that most Americans eat now. But you're also not going to have to cook from scratch all the time. But it works. But the key, no drug hit for a month, none. You can't have cocaine. So it's like I've told Sheila this before, it's like us doctors saying to our cocaine addicts, hey, listen, They're like, I want to quit doing cocaine. And we're like, sure, we're with you. But every day have a little hit.
Okay.
That's what we've been telling our patients when we're telling them to lose weight. You have to do all this, but then have a hit. It's impossible for them to do it. So I say no hit for an entire month, and this starts working.
So give us an example of what you mean by the processed foods. Are we talking, and we get, how about like the everything low fat, or tell us what we look at when we look at the container of the food or the can or whatever it is we're getting from the grocery store. How do we know how processed it is?
So first of all, you're not going to have to read a lot of labels because most real food does not have a label. Okay. So number one, if it has a label, it's obviously somehow processed, right? So for that first month, you don't do anything with labels other than whole fat yogurt. And then after that, the way you do it is, so food is alive. The more steps that are done to that food along the way before it gets to you, the more processed it is and the worse it is for you, even if you do it at home. All right. So for instance, whole fat yogurt versus fat-free yogurt, or fat-free milk. So to get lower fat milk, all they do is scoop out the cream. Boom. You do that at home. So that's okay. But to get skim milk, they drive hydrogen ions through it to knock off that piece of fat. So you're left with basically sugar water. And so it's more processed and hence worse for you because you're getting no nutritional value from that. And you're not even getting that 10 calories, a tiny bit of fat that's going to keep you full longer. So you're not craving food again because of that sugar rush. So again, nature does a better job than a factory every single solitary time. So back to your questions, what do you do with the containers? So if you happen to have to read a label, it's processed, but it can be minimally processed. So all you have to do is look at the ingredients. So it should be a short list of ingredients because if you made it at home, you actually don't use that many ingredients to cook stuff, right? So step one shouldn't be a lot of ingredients. Step two, can you identify every single thing of those? And if that answer is, I have no idea what this word even means, put it back. You wouldn't have made it that way at home. However, if it has short list of ingredients, you can read all of the ingredients and you'd say, hey, you know what? If I had time, that's how I would have cooked it at home. Then you can eat it. That's food. That's real food. And that's how you do it on the labels.
And so are you having success with some of your patients? Because you're saying that if they do this, if they follow this regimen, it will cut down on the chances of reoccurrence of the cancer. Is that right?
Yeah, that's correct. And I just have to get them to lose like 10 pounds. But yeah, so step one is, I have to teach them how to do this. I send them my book, which I still haven't published, but it's functional. So I'm using it all the time. And so I give them the framework to do it. But then the next step is on them. And not everyone actually jumps in and does it. It's amazing. But when they do, it works. I have a lot of my patients, they've dropped like 40, 50 pounds and have kept it off. Even my medical assistant right now has done it, because I taught my staff about it. And she's dropped a ton of weight. And she was like, wow, this is really easy because she doesn't think about food anymore. And she's dropped over 80 pounds now. So,
wow.
So if you do it, yes, it works. And there's no rules. The only rule is it real food? Yeah, you can eat it. I mean, that's it. And then I teach you, obviously, nutrition. Mostly the best way to eat is to be a vegetarian diet with a little bit of meat. And no process. And by vegetarian, I mean, that doesn't mean you can eat snacks because it's not meat. It means vegetables.
Right.
Lots of vegetables and a small amount of meat, tons of fish, whole fat yogurt, plain yogurt, best thing ever for you for a variety of different reasons. And it's delicious. That's it. There's no rule.
It's hard to get whole fat yogurt in the stores. Everyone is selling just the low fat stuff. Yep. It's impossible to get the regular yogurt. Do you find that?
Yeah, that's the hardest thing I have to find, to be honest with you. It is harder for me to find that than anything else because everything's like fat-free skim, it's horrible stuff.
Right.
I'll just say that.
All right. Well, this has been a great discussion. I want you to give us a finale. Combine everything we've talked about. What do you have to say as a physician, helping people learn how to live, how to be healthy? What are your final thoughts for today as we end this program?
So my final thoughts for today are wear your mask, wash your hands, eat lots of vegetables, and be good to each other. And always hold on to hope. because I still have hope. Even despite all the stuff that's going on, I will always constantly have hope, both for this country, the pandemic, and for my breast cancer patients. Hope.
Okay. Thank you. On that wonderful note, thank you so much, Dr. Lisa. Tito, California, Mattapoisett, Massachusetts. It's great seeing you. I'll see you outside in a few minutes if it's not raining. And everyone, we'll see you next time on Talk Back. Actually, stay tuned. At 1 o'clock today, we have part 2 of our discussion about Prudence Crandall and the School for Black Girls in Canterbury, Connecticut. Love to see you then. Bye. Thank you. Thanks, Lisa.
My pleasure.